CEN Test Prep Exam Core 1. Question 1. The antidote for benzodiazepine overdose is Option A. Naloxone, Option B. Flumazenil, Option C. N-acetylcysteine, Option D. Atropine. The correct answer is Option B. Flumazenil. Question 2. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A. Diltiazem, Option B. Verapamil, Option C. Metoprolol, Option D. Digoxin. The correct answer is Option D. Digoxin. Question 3. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A. Pinpoint pupils and respiratory depression. Option B. Dry skin and absent bowel sounds. Option C. Hyperreflexia, clonus, and agitation. Option D. Bradycardia and hypotension. The correct answer is Option C. Hyperreflexia, clonus, and agitation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is Option A. 250 ml of 0.9% normal saline. Option B. 500 ml of D5W. Option C. At least 30 ml/kg of isotonic crystalloid. Option D. Packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is Option C. At least 30 ml/kg of isotonic crystalloid. Question 5. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A. Abdominal X-ray. Option B. Abdominal ultrasound. Option C. CT scan of the abdomen. Option D. A complete blood count. The correct answer is Option C. CT scan of the abdomen. Question 6. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of Option A. Hemorrhagic shock. Option B. Cardiogenic shock. Option C. Neurogenic shock. Option D. Septic shock. The correct answer is Option C. Neurogenic shock. Question 7. A patient with suspected bowel perforation should have which initial diagnostic study? Option A. CT scan with contrast. Option B. Abdominal ultrasound. Option C. Upright chest X-ray. Option D. Colonoscopy. The correct answer is Option C. Upright chest X-ray. Question 8. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects Option A. Cystitis. Option B. Pyelonephritis. Option C. Nephrolithiasis. Option D. Renal artery stenosis. The correct answer is Option B. Pyelonephritis. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates Option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is Option B. Hypoperfusion and anaerobic metabolism. Question 10. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with Option A. A scalp laceration. Option B. An orbital wall blowout fracture. Option C. A nasal fracture. Option D. A mandible fracture. The correct answer is Option B. An orbital wall blowout fracture. Question 11. The best method to remove a prosthetic eye in an emergency is Option A. Using forceps to grasp the prosthetic. Option B. Applying suction with a bulb syringe. Option C. Using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 12. The purpose of administering surfactant to a patient with ARDS is to: option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Question 13. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 14. The most common cause of acute renal failure in hospitalized patients is: option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 15. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Question 16. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, a surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Question 17. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Question 18. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates: option A, bulergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 20. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to: option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. Question 21. A female patient of childbearing age with abdominal pain should always be evaluated for: option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Question 22. a patient leaving against medical advice (AMA) must be informed of? Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. Question 23. Hepatitis A is primarily transmitted via option A. blood and body fluids. Option B. fecal minus oral route. Option C. sexual contact. Option D. contaminated needles. The correct answer is option B. fecal minus oral route. Question 24. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is option B. Keep the patient NPO and provide aggressive 4-fluid resuscitation. Question 25. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with option A. gastroenteritis. Option B. bowel obstruction. Option C. irritable bowel syndrome. Option D. acute pancreatitis. The correct answer is option B. bowel obstruction.